Oh, hello everyone. Welcome to the 17th episode of the AI Healthcare Podcast. I'm your host, Dylan Reed, and today we are joined with my friend, Sigrid Berge van Rooijen, who is an AI healthcare consultant at IR Health. Thank you so much for your time today, Sigrid.
Thank you, Dylan.
And what made you realize that AI in healthcare was the right field for you?
Good question. So it takes me back from all the time, like when I was young, because how I ended up in healthcare in the first place. So I had a very early experience with the healthcare system due to a dad who had a car accident. So we saw the healthcare system from different sides, from being in the hospital, but also having rehabilitation and
Mm,
trying to build himself up. Back then, I just knew already I wanted to do something with people, work with people, and that I could contribute in healthcare.
mm,
So that's how I ended up in healthcare. But as I started working in healthcare, I was so frustrated with the whole system, how the whole system worked, and how the inefficiency were there, how you're wasting your
mm,
time with nonsense and not being able to give the patients the right treatment you should be able to give. By coincidence, I ended up with a job in tech due to
mm,
because I was moving to a different country where I didn't speak the language and English. You can work in English with English and tech anywhere.
mm,
Um, and going deeper and deeper in the tech world, that's how I also explored and experienced AI.
mm,
And that's what was more of an epiphany, understanding like, wow, what is actually possible with with technology, not necessarily AI, but with technology. But more and more as my understanding of AI has increased, I'm like, it is insane how we're working currently and
yeah.
what's actually possible and how we can bridge that gap. To be able to give patients much better healthcare, much better treatment, and better diagnosis.
Mm,
There's so many ways where I'm like, wow, I'm excited to talk more about that afterwards, but I think that's the more I've understood about, like, it comes from the frustration of the healthcare system, um, but the more understanding of AI and the tech field.
mm. And kind of what you were previously alluding to, with your experiences in the healthcare system. What are some of the most common inefficiencies that you have seen, specifically with medical companies that are looking to enhance their organization with AI?
From medical companies or with healthcare like systems,
Uh,
both.
both.
Both. So I'll take healthcare first.
Mm,
'Cause, yeah, related to when I was working in healthcare as well. Well, first of all, I know healthcare systems around the globe, they're different. You have different systems, you have different everything. But I think what's more common for most of them, you have to figure out who you're talking to, or like what patient you're talking to, and what
mm,
has happened with that patient previously. So trying to figure out somehow like this summary, like like what diagnosis is actually up to date,
mm,
and what should I consider when I go into with a treatment with this patient. But that is quite, at least when I was working, and this is systems I've tried,
mm,
have been cumbersome. It's not been clear, okay, what has actually happened with this patient? What do I need to consider? And what type of diagnosis do I need to consider? If you're lucky, a doctor had gone through the whole journal before, made a summary, so you kind of can take it from there, but you don't really know. So you spend a lot of time just reading back medical records, which is not necessary. You can have some summaries of that.
yeah.
That's where AI come in and summarize what's the most important treatment, what's the most important information,
Mm,
but also what type of information you should put into the records, or um, what type of information you should highlight to the readers. So a lot on like the medical records and the admin part. But then you also talk about, like, if you look further through, like, how do you book even uh, a new appointment for the patient in the hospital? It's not always that straightforward. Um, and the old school system they used when I was working in the hospital, it looked like it was built in the 80s, and I was working there in 2012,
Wow.
and I was like, you couldn't even use a mouse. Um, it was just these things that I'm like, I can't believe that you're actually accepting that you're working like this.
Mm,
But that's more the technical part of it and the admin part of it.
mm,
But also when you're working with the patients, how much time do you need to take in order to um, look at the diagnosis or take some screenings or get the results of that. It's just like, why does a patient need to wait so many days for that when you can get it straight away?
Hmm.
And the same comes for, I think, medical companies, medical device companies, etc. Um, you have, you have a lot of companies, and they have a lot of tools, and they can even digitize a lot of it. Um, but whether they feel, okay, it's their responsibility to make it easier for the user, or it's just like they provide the tool, and then the user, the hospital in this case, would need to figure out how to kind of like simplify that.
Hmm.
Um, I think that's how AI could be used as well for these companies to simplify that whole process.
Hmm.
Imagine like if you had, and I know a lot of companies are starting to look into that. Um, but if you have, easy example, X-ray machine, that you can already implement AI tools into that, like so that the end user would know what diagnosis it is when it takes a picture, or it would know, okay, at least like where are we in the body? Like are we talking about lungs? Are we talking about the leg? If I could already detect that.
Hmm.
Um, so a lot of ways you could simplify that. And I think right now you also like what you hear, and I'm not surprised about that though. It's like you have companies say, yeah, we're using AI, but is it really AI, or is it you have a team in a different country just doing the manual work for you? It's not AI, It's just like to simplify these processes, and those processing can be used with AI. For example, like sending an image to another country for them to, either make a report of that or digitize that one way or the other. But they have people doing that instead of AI. So instead of taking them a couple of minutes, it would take them 3, 4, 5 days for the results to come back to the end user. It's not AI.
Hmm.
If it takes that long time, it's not AI. Um, so those way, I think there are many inefficiency, if both in the medical device companies, but also um, with the healthcare providers.
Hmm. And what you just said um, kind of goes into my next question nicely. What are some of the biggest arguments or even misinterpretations that you hear from specifically health systems or medical companies about artificial intelligence?
I think, yeah, the biggest misunderstandings. I think it's more Um, from my conversations, there's a lot of like lack of understanding, I think. So it's more, oh yeah, it can be used for business intelligence. It can be used for marketing purposes or for, like the commercial part of it.
Hmm.
And not realizing fully potential in healthcare. Like they're a healthcare company, but they don't fully understand the benefits. It could be the added benefits if they use it for the clinical operations as well.
Hmm.
And so that's one part. So I think a lot is focused like for the quick wins, more, yeah, for business intelligence, which is easier and less risky. So I do understand that.
Hmm.
Um, and then secondly, and not on like trying or daring or wanting to explore whether or not it would give added value for the company, or understanding how AI could be used, because I think it has, like, I think we've come quite far in the last 1.5 years in understanding AI and how it can impact healthcare.
Hmm.
But I still think there's a lack of understanding to what extent, or to how can actually my company be using it. Um, I talked to several companies who are like, no, well, we haven't, like, we've already, like, AI is cool. We've reviewed our process, and we don't think it's relevant for us to have AI or use AI somewhere. And I have a conversation with them, and I get already like five ideas popping up in my mind, like, oh, but you could be using it here, here, here. Um, but it's somehow like this lack of understanding.
Hmm. Yeah, that kind of it's very similar to what we hear in the United States. It's kind of, I'm scared of this technology and its capabilities, and if
Yeah,
it's implemented, am I going to lose control of any business operations that I previously had control of?
exactly. And then I'm thinking there are two things actually. If you do add AI into that, you
Mm.
could be using that as an additional selling point, because your process, your tool would be more efficient than anyone else. And
Mm.
you actually, because a lot of users actually they're like, how can I use AI right now? How can you simplify that process? But for them, it's also a big, they need to think a bigger process and a bigger complexity. If you just say,
Mm,
okay, we have it already for you, well, you win. If there's a competitor who doesn't have AI, well, you win,
mhm,
um, because you simplify that process for them. But then you also have the user, the end user. Do they really trust AI and the AI systems and the results um, coming from the models? And I think that's also, it's not just the healthcare systems. Obviously, they need trust as well, but it also needs to be the patients and the ones
mhm,
who's actually gonna, the end user is gonna really feel the impact of these tools.
mhm,
Um, so yeah, there are a lot of challenges in it, and not even just starting to talk about how doctors are in this. Not only doctors, but people in the healthcare professionals. I mean, are they open to AI and support in their processes, or are they afraid of losing their jobs?
mhm,
Because that's also something, like some of the conversations that you hear, like, yeah,
mm,
but like if AI is going to take over this part, well, I'm not going to be used anymore. So what are the doctors afraid of? Are they afraid of they're going to be ending up on the street? Like, is that really realistic when you look at how many people or how many more people we need in the healthcare system right now? It's not realistic at all. Maybe that little task, you
mhm,
won't be doing that anymore, but there are so many other tasks you'll be doing.
mhm,
Um, so I could go on and on of this stuff of bad examples I've heard of people coming up with solutions for doctors and that performed quite well. That had the same accuracy as doctors,
mhm,
and the doctors and when they come to like, hey, do you want to use this tool because it will simplify your work? The doctor's like, no, let's do it ourselves. Like, for what? Because you want to make sure that the patient still need to wait 3 months in order to get a reply from their test, or what is your, like, what is your motivation there?
mhm,
I think there are a lot of education that needs to be done from different sides, like from the patient. They need to trust the results. The doctors need to trust and understand that their jobs are actually not going to be taken over by the machines or the robots. It's going to support them, and that they can actually focus more on the patients, but
mhm,
also from the medical device companies, how they can actually use the AI models and tools that are available to put their tool apart or their device apart compared to competitors.
mhm. No, that's very interesting. And so I want to preface this next question by just kind of saying, so I understand, that within the European Union, each country is different depending upon like how they want to do their own kind of countrywide affairs. Um, but I just want to have a just an understanding from you is what do you see the main differences between the United States, the European Union, as well as the United Kingdom in relation to how each of those respective areas have adopted AI in healthcare?
Um, yeah. Well, I think first it really, yeah, it depends on the country. I guess it depends on the states in the US as well.
Hmm.
From my understanding, when you look at how many devices have been approved by FDA or uh, the EU regulatory bodies, you see many more approvals in the US than in Europe. If you look at where they come from, like where the companies have been developed, like where their headquarters are or whatever,
Hmm.
a lot of them are also based in the US. So I think more like from like what I know of where the companies are based and what's happening, a lot of them are in the US.
Hmm.
There was quite a lot happening in Europe, depending which country you go to. I think you see more in Northern Europe that are more advanced when it comes to that. But on the other hand, you also have countries there, speaking from experience, that want to kind of like do their own thing or go their own path or don't ask other countries for advice how their process was. So they go through the whole same struggles to come through the same and need to go
Hmm.
through the same loopholes. And I'm like, oh, come on, there's a solution for this. Or like, if you just do your research up front, you probably not choose this tool. But yeah, and I think there are a lot. I think EU they have a lot of regulations as well, which is good. They wanted like EU they want to take care of the security and the privacy and
Mm,
safety of their inhabitants. So you have the GDPR, so the data protection rights, for
mm-hmm.
example, which is not about AI at all, but more like the data privacy. But I think then you saw just like every tech company in the world just had to like restructure how they save the data because European data needs to stay in Europe.
Mm-hmm.
Um, so you can't just send it to the US for um, being stored there. It needs to, so they need to like work on the data centers. And now you see, so you have the medical device regulation also in Europe. So before, Europe used to be an easier country to have get a medical device approved, so you can sell it, go to market. But after the medical device regulation is still being implemented, there are more requirements of
Mm-hmm.
like what they need to do in order to get the approval.
Yeah.
So you see a lot more companies, European companies who have like that has their headquarters here. They didn't even go through medical device regulations because they don't have time for that. So they go directly to the US for FDA approval because it's faster, so they can go faster to market there, and then afterwards they'll go to Europe. So the innovation, like even though it's innovated in Europe,
Mm-hmm.
um, kind of goes to to the US first, and then it comes back. So I
Oh.
guess maybe US is like the guinea pigs here. So, um, yeah, and whether it's good or bad, I think you do see a lack of innovation then, or it's more difficult to get innovation across in Europe.
Mm-hmm.
I've also heard stories about regulations that have been on a national level and come up to make it difficult for digital health companies to actually be used because of the new regulations that they cannot be used in combination with uh, telehealth and some other like AI tool. I can't remember what it was, but like these combinations cannot go hand in hand, which makes it very difficult. So you cannot have a strong and innovative uh, device or solution because
Mm-hmm.
regulation is stopping it a bit. On the
Mm-hmm.
hindsight, I think regulation is needed because it does look at the safety, so that you have, that the devices that are actually used here, they have been clinically evaluated. They are safe. They should be efficient according to the data that they showed.
Mm-hmm.
Um, which I think both also US has regulations for this. So I think that sense, like I will be more comfortable using tools that have gone through
Mm-hmm.
some regulatory process than tools that have not.
Mm-hmm. That's that's very insightful. And so I'm not an EU UK expert. So based on kind of what I've read, it seems like there's a lot of frustration specifically around AI regulation with countries versus kind of the EU governing body in Brussels. And
Mm,
it's kind of the question that it seems that from what I've read that really pops into my mind a lot is, should Brussels be a more kind of regulatory body, or should it be kind of more of a recommendation based type of body? You kind of
mm,
see a lot of the similar arguments here in the United States of, should AI, should this be a state driven issue, or should this be a
mm.
federally ran issue? Are you kind of seeing that kind of play out in Europe right now?
Mm, I don't see those discussions that much.
Uh-huh.
They're probably out there. It's more okay. The EU, then or like a new EU AI Act is
Mm-hmm.
coming, which will have big impact on the AI tools that are being used in Europe.
Mm-hmm.
And I think with a lot of laws, like EU, just like they come up with the main law, and then the other countries they can have their own laws, but that's on top of it. Like they need to follow the EU laws first, and then can add additional things to it. And I think well, that's just my opinion. But looking at what they want to achieve with it, is they want to make sure that the fundamental rights are being respected in EU and the values of EU are being respected. So if
Mm-hmm.
every other country would have their own rules, which they can on top, but the base is that the fundamental rights and values are respected,
Mm-hmm.
then it's good. But if you take away that, how would all the different countries? Because there's so many big there's so big differences within EU itself.
Mm-hmm.
Just looking at, you know. economic reasons or culture, like what's important. And if I don't know if the rules will probably be very different.
Mhm.
Um, so I personally I think it's good that you have one overarching
Mhm.
law or regulation.
Mhm.
But obviously it's not finished yet, but they've they're close to finalizing everything.
Uh-huh. No, that's great. And could you just give us like like a 10,000 foot overview of what the AI Act is and what makes the provisional agreement significant?
Well, it's the first one in the world that's trying to regulate AI somehow. So they've classified the AI tools in different risk levels. So
Hmm.
you have minimal risk, limited risk, high risk, or unacceptable. Um, and by minimal risk, it's like spam filters for your email. It's um, very, like things that you're already been using, but you don't really notice it a lot. Limited risk, I need to need to look more into that, which ones that will be. But when you come to high risk, that is where medical devices, everything is medical, comes into high risk, because there's a risk of respecting fundamental rights and whether bias is a part of it. And I think that's key. And it's not just EU that needs to be aware of this, because any tool that wants to sell into the European healthcare that has AI into it would be high risk.
Hmm.
So they need to make assessments themselves, the devices that use the AI. Um, but they also need to the um, healthcare providers that are implementing these AI tools also need to make assessments to make sure that they are actually respecting fundamental rights for it. And you need to have tools in place or solutions in place to detect bias, which is great because you see a lot of bias in AI models. Um, to make sure that they're trustworthy. How is it about like cybersecurity? So there are a lot of things, and I just foresee seeing more of um, what's it called? That you oh, man, I'm losing my words. Explainable AI into this as well to be able to explain your model and how you came to it. I haven't seen that specifically in the wording, but from what I can read, I wouldn't surprise me if that's going to come more on uh, on top as well, and like ethical AI.
Hmm.
But having explainable AI, it's another discussion as well, because can everything be explained? And can we even explain everything that's happening in healthcare and why we're making the decision we're making?
Hmm. No, that.
So if you cannot do it there, you can't expect a model to be fully explainable either.
Hmm. Well, what's the old saying? It's you can have the best model in the world, but if you have bad data, it's still going to be a bad model.
Yeah, 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 totally.
and and what would you like policymakers to understand about how AI improves patient outcomes while at the same time decreases healthcare spending?
Yeah. Well, first of all, I think with AI as well, like having this conversation whether or not it should be used in healthcare. I'm pro, by the way, if that wasn't clear. Um, but I think you need to look at like how are the current systems right now? Because I think we're very critical to the AI models and the accuracy and um, how the AI models are being used in the healthcare system. But we're not critical to the doctors that are there, are we? Like what are their accuracy levels? So if you can look at the difference between a expert like has like 25 years experience in their specific little niche compared to someone who just finished their studies and are going to work with the same patients, they're going to have a very different accuracy level, if you want to say it like that. Um, but that's okay because you're human, and like you need to learn as a doctor, you need to be there. But adding AI onto it, you can really support the young doctor that's coming into the healthcare system to support them. Okay, to know what type of diagnosis is what you need to really consider, so that. it doesn't really matter if you come to a university hospital, or if you go to a rural hospital somewhere else. Like the quality of care should someone like be more equal than it
Mhm.
is right now. Because if you look at hospitals around either in one country, or around the globe, you'll see very big differences for the same treatment.
Mhm.
And I think AI could be a part of improving that and improving patient care with that.
Mhm.
Obviously, having implementing AI is costly, and it is an investment from for the for the hospitals as well.
Mhm.
So I'm thinking like support somehow there, or even though they would in the end be able to save some money either with direct diagnosis. Um, I didn't mention it up front, but my dad died because he got the wrong treatment from his cancer. And
Mhm.
AI wasn't available. Like, well, AI was available when he passed away, but there wasn't an AI tool for that, as far as I'm aware. Um, but if AI would be used in these cases, that you could actually figure out, okay, what type of treatment should a patient have, even though they have the same diagnosis, but there are different, parameters that make sure that a patient should be having chemotherapy compared to surgery or whatever. Um, that could really like reduce patient deaths that you didn't need to. And I don't know how that is in the US, but imagine if like hospitals would be sued if the treatment, like if they don't have high enough standard of treatments, or you get wrong treatment or your wrong diagnosis. How many
Mhm.
percentage don't even get like wrong diagnosis right now? Is it 10%? I'm not sure. There's quite a big number of wrong diagnosis.
Mhm.
So understanding that, like what's really happening right now without AI, and how can AI be used on top of that to improve both the diagnosis, the treatments, and the whole patient um, treatment plan. Um,
Mhm.
that that is essential, and then see what would happen if you actually look and add AI to it, to the pot. How many more patients would you be able to treat per day or per
Mhm.
year? What would the quality of the treatment be? What would be the quality of the well, that also reducing the costs. If you know already straight away the treatment that would actually be efficient with a patient, well,
Mhm.
isn't that logical? That would be cheaper than
Mhm.
having to go through like 5 different type of treatment options. But also the shorter the time that the patient is actually spent in the hospital, because AI could either, like you have quicker diagnosis, your treatment would be quicker, more effective, but you could also maybe have like follow-ups at home with your digital health device, like with your app, or obviously together. Not it's not just the patient and technology. The doctors and the clinicians are also part of that. But it's a complex picture,
Mhm.
and it's not just good or bad, yes or no, black and white. You need to understand the full picture in order to know how you would the benefits of it, but also how you would implement it.
Mhm.
Um, so yeah, I would really recommend looking into like what is being used right now, how our treatment's being used. I also know there was a study, and that's a lot back in the days, but a study from Denmark, when they started looking at what's the outcome of breast cancer patients across the country, depending on what type of hospital they went to.
Mhm.
And every hospital, they thought they gave great treatment. Then they figure out, when they compare these numbers, they actually figure out that one hospital underperformed so much, and they weren't aware of it. Like they were not aware of it before they saw their data compared to the other data, and that's when they could really start looking into how they could improve the treatment plans, the efficiencies, and look into better ways of treating that patient. And when you look at that, and you will look at the data and the evidence,
Mhm.
that's how you can improve it. And it's the same way with AI and whatever tools you do. But you can't just look at one department. You can't just look at one isolated hospital. You need to compare it as well.
Mhm.
And compare what I mentioned as well, compare doctors with each other, which also would give stress for the doctors. I wouldn't want that for them at all. But more that AI could support them to keep the quality up.
So no, that's very insightful. And where can people find you, Sigrid?
You can come visit me. I'm very active on LinkedIn.
Mhm.
So Sigrid Berge van Rooijen. Um, yeah, you're free to connect or follow me for more insights and ask me any questions. I would also love to hear, like what are people you or your listeners interested in hearing and about AI or how it can be implemented in healthcare.
Awesome. No, that's great. Thank you again. And do not forget to hit the like button and subscribe to my YouTube channel. Podcasts are also available on Spotify and Apple Podcast. And do not forget to check out my newsletter, the AI Healthcare Report on LinkedIn. This is Dylan Reed signing off. Thank you so much again for your time, Sigrid.
Thank you.